By the time others join, we just go for a high-speed revision of what we did last time, and then we'll be continuing. Because hemoglobin is considered as one of the most important topics, and so many questions will be associated for any of the exam. Right? Thank you everyone for the questions. Okay. So starting with this hemoglobin, what we learned last time was that hemoglobin is present into RBC. Change the colors. So which is RBC, and it is also called as the erythrocyte. Erythrocyte is erythrocyte cells. Kidneys, they will be releasing the enzyme, and that leads to erythropoiesis, will be affecting the bones, in fact, the bone marrow. In the RBC, there is no nucleus, no mitochondria. So that's the reason mitochondria requires oxygen. So it won't be able to use oxygen. That's the reason that there will be glycolysis, which is the anaerobic process. The life of RBC is 120 days. Technically speaking, there is iron in between, and there is surrounding the pyrrole ring. And then we learned how to really draw the entire hemoglobin structure, in which these were the steps that we start with the drawing of pyrrole ring. Then the numbering system is what we learned, and there was like methyl group, which is to be added at 1358. We just started. We are doing the revision what we did last time, so you have not lost anything. So this is the vinyl group, and at position 2 and position 4 we had the vinyl group, and the propionic group CH2, CH2, COH at 6 and 7. So thus all the 8 positions they have been acquired, and then the inner ring is to be connected with CH, and then we added the resonance bond, that is alternate one single one. Start from anywhere, still the structure will remain the same. And finally, the placement of central ion parasite. Okay, so this was the thing. Right? That's how we really drew hemoglobin divided into heme and globin. Heme is molecule, globin, that is the polypeptide, and in which there are 4 chains in 2 pairs. These are all basically proteins. So in types of hemoglobin, we talked about 3 types of adult type, right? So that is hemoglobin A, adult type 2, that is hemoglobin 2, and the hemoglobin F, that is the fetal hemoglobin. All this thing depends upon the chains alpha, beta, gamma, and delta. So when we have got adult type, which is comprising of 95% of the hemoglobin, it is alpha 2, beta 2. That means 2 chains of alpha, 2 chains of beta. Right? In case of alpha type 2, 2 to 3% of hemoglobin is comprising of alpha type 2, that is alpha 2 and the delta 2. When it comes to gamma, gamma is associated with the fetal hemoglobin. Right? So this is the alpha 2, gamma 2. And it is this gamma chain which has got tremendous affinity for the oxygen. So here we started with the fetal hemoglobin. Can be written as HbF, hemoglobin F, or the fetal hemoglobin. And after 8 weeks of intrauterine life, right, this starts getting produced. That newcomer, that fetus, will be having 90% of the hemoglobin of HbF type, and it has got super affinity. That is the spatial attraction or the love towards the oxygen. That is very high. So after birth, or weeks or months later, we find that the hemoglobin F, it starts going down, and in adult it comes down to less than 1%, and less than that. Right? So over here, the reason behind it is that in the maternal circulation, when we are getting the blood into the fetal circulation, in the fetal circulation, it is the mixed blood which is getting actually circulating in the entire body. In order to clarify this concept, what we did is, we understood that from placenta, it is the umbilical vein which is carrying absolutely fine oxygenated blood. This is coming via umbilical cord. And yes, as one email which was received, just for the clarification, said, remember this, it is not so, it is the same umbilical cord. So over here, 1 and 2. right? These will be the umbilical arteries, which will be returning the blood to placenta, from placenta to mother. And as over here, everything is with respect to heart of the fetus. So that's why they are called as the umbilical arteries. So that isn't this collectively, this whole thing, then this is surrounded by, right? There is this entire thing is surrounded by a jelly. That jelly is that gives a sort of protection. At the same time, it gives a specific temperature control. This jelly is called as the Wharton's jelly. Wharton's jelly. And this whole package is called as the umbilical cord. So this umbilical vein and one which we drew over here, this part, right? This umbilical, they are same. They are same. This whole thing is umbilical cord. So no confusion. Umbilical cord, Wharton's jelly, one umbilical vein and two umbilical arteries. That is what we are doing. Over here, that was the reason, was umbilical vein which is carrying oxygen. That oxygen, it will go to liver. Liver will be using it fully, and then it will be putting the blood which is having carbon dioxide via hepatic veins into the vena cava. Now, where is the blood? Where is the oxygen which is to be given to the entire body? That's why this important piece, this is the bypass. It is the bypass which is called as the ductus venosus, as it will be going from umbilical vein to the vena cava. That's why it is a duct created between two veins. Right? So this is also vein, that one is also vein. So that's why a duct created between two veins. That is the literal meaning of this ductus venosus. Similarly, the way we say ductus arteriosus. So ductus arteriosus, so here is the pulmonary trunk, correct? Pulmonary trunk. And then there is what? This one is our arch of aorta. So in between both of them, that is in between the two arteries. So that's why it was called as the ductus arteriosus, right? Ductus arteriosus. So duct between two arteries, pulmonary trunk, physically an artery, going out of the heart, aorta base, definitely. That's why it's ductus arteriosus. And here we talk about circulation. So from umbilical vein, the blood comes from the vein, and then comes into the circulation. Wharton is scientist. That's right. Wharton is scientist. Okay. So it is the mixed blood from the vena cavas. It will be going into the right atrium to right ventricle. From right ventricle, there is no point in going into lungs, but even if something escapes, so that goes into the pulmonary trunk. From pulmonary trunk, it will go to aorta, right, via the ductus arteriosus. However, rest of the blood, most of the blood, it will be going via this aperture or the hole, which will be going from right atrium to left atrium, and that is foramen ovale. It is a foramen which is in shape is oval. That blood is pushed into the left atrium. From left atrium, it goes to left ventricle, and from left ventricle, it goes to aorta. It's at this point when the blood is from all the sides, it has been received and it moves further. As it moves further, it gives blood to brain, head and neck, and over here to lower limb, and then it distributes. However, this common iliac artery, which divides into external iliac and internal iliac, and this goes to femoral artery. Yeah, the blood is also getting mixed from right ventricle and left ventricle. No, from right ventricle, left ventricle. Right? This was just in case if there is any, if this is a gap, right, in the form of ventricular septal defect. It's called as the VST, ventricular septal defect. Normally, there is no ventricular septal defect. It's fine. This though we'll see when there is any abnormality. Otherwise, the blood which is from right atrium to left atrium, that goes into the left ventricle, and small amount of blood which has escaped and it has entered. Lungs are totally into water, so that's why it will be pushing back. via this route, and you go into the. So that's it. And then the internal iliacs, they will be continuing all the way into the form of umbilical artery via umbilical cord and then sending carbon dioxide back into the placenta. So that is how things really they keep on moving. Globin proteins, if there is any problem in these proteins, so that will lead to disorders, blood disorders. So if there is decreased production of alpha unit, so then it leads to alpha thalassemia, which is a hemolytic disorder. Blood cells break. When there is problem in beta, then it is called as the beta thalassemia. Now there is minor and major. Both of these. Minor is what? So minor is when there is only one gene is affected. Major is when the two genes are affected. When only one gene is affected, so then there are no sign symptoms. Right? Everything is fine. What is sign symptom? Sign is the doctor elicits, you elicit, that is the sign, and symptoms when the patient tells. The patient tells that I'm having this problem in his own language. Right? So that is the symptom. The third one is the sickle cell anemia, in which there is increased hemolysis because the shape of the cell, that is like the sickle shape. This is the shape. So they break very easily. They break much easily. And this is what is called as the. So that's why this is over here. We talked about karyotype. It's very important. Okay, it is the spleen where the healthy cells, these are the healthy cells, healthy RBC, which will move all the way, be able to cross the barrier, white pulp and red pulp. And rest, abnormal cells, they will be breaking down. So they break over here. Okay. There is another important concept, that is 2,3 bisphosphoglycerate. BPG, 2,3 bisphosphoglycerate. This BPG, it promotes oxygen release from hemoglobin. So it tells the hemoglobin to release the oxygen. So that's why this would be much better when we are near the tissues, because it will increase the oxygen delivery to the tissues. When it is near the tissues, it will tell the hemoglobin, Jani, right, release it. So that released oxygen that can be utilized by tissues. Right? In case of RBC, no mitochondria, no oxygen. So that's why it's the glycolysis. And this is one of the steps. This is during the process of glycolysis, this is one deviation. How is it? Okay. By the way, this is 2,3 BPG. That is at high altitude. It will be releasing more oxygen so that tissues will get better oxygenation. Here is the process of glycolysis as such. The whole game starts with 1,3 bisphosphoglycerate, 1,3. And in between, in the presence of this BPG mutase, that is an enzyme, which acts on 1,3 BPG and it converts it into 2,3 bisphosphoglycerate, 2,3 BPG. Right? And it is this 2,3 BPG which will be telling the hemoglobin that will release the oxygen. Right? Meantime, rest of the process would continue in the form of 3-phosphoglycerate, and then it goes to 2-phosphoglycerate, 2-phosphoenol pyruvate, 2-pyruvic acid, or the pyruvate. It is the pyruvate which is giving the energy. So this is the importance of hemoglobin. Two types. One is the taut type and second is the relaxed type. Taut type, or the T for tissues. So it has got affinity for, so it has got low affinity for oxygen. That means if the oxygen is going, then they are not much affected. Say it's okay, right? So they have got low affinity or low love for oxygen. That is what is needed at tissues, because they are not very much attached to the tissue. So oxygen will go, and that is the oxygen which will be used by the tissues. The second form, R form, or the relaxed form, in the lungs. So over here, they have got tremendous affinity for oxygen. So it is good for the lungs. It is good for the blood, because they will immediately pick the oxygen from our breath and put it into the circulation. But this was what we discussed last time. Now for today, we'll straight away start with what's called as the dissociation curve. Dissociation curve. Now this dissociation curve will make you understand some of the terms when they say it is shift to the right or shift to the left. In clinical notes are fine. This is what is called as the dissociation curve. On one side, we say hemoglobin percentage. How much hemoglobin is saturated, right? It means it is picking up the it means it is saturated. That means it is really picking up. How much? What percentage? And this one will be what? This will be the pressure of oxygen. The normal pressure of oxygen. So as we increase the pressure, we find that there will be more and more utilized, more and more pickup of the oxygen. So here is this is the PO2. As we increase, as we breathe, because you know that when we breathe, right, more air is going in, more air is going in, so the pressure is rising. So as we breathe, this is like, let's say this is our 100%. Our full breath when taken, that's it. That is our limit, 100%. So we divide this into 50%. This is 25. We don't need to go beyond 100%. We can't take air more than 100%. So here it is. The whole game starts. Hemoglobin as it increases. It goes like this. And then at one point, so even any amount of air which is taken in, hemoglobin cannot be saturated. That's got a limit. After that, even if you breathe heavily, still that air will simply be passing through the capillaries and will move further. It won't be going into the can't, because the hemoglobin has been saturated. So the curve which we drew like this is, in fact, of myoglobin is what is present in muscles. So they will keep on absorbing till one level, and then that's it. The limit is. This is not the case when we are talking hemoglobin. In hemoglobin, there is a concept called cooperative. Cooperativity is. Give this example. Back to Medical College, and it's evening 4:50, and we are looking at the watch. 5 baje, and third floor. From third floor, we used to rush. Cross the ground, go to hostel, bag already packed. Right, यहाँ से लिया. Rush to the bus stop. Right, bus 50 number की bus already ready, and reach to the railway station. And then the timing of the train 6:10. Reservation तो is out of question. And then one person would literally सबसे लड़ झगड़ के चल हट, right, and then go inside, because the train used to enter on the platform at 6 o'clock. So and bus we used to reach this much early only. So jump मार के अंदर चढ़े, and then एक रुमाल रखा, right, यहाँ पे हाथ रखा, इधर बैग रखी और इधर पाँव रखा, right? And then you say these are my seats. Right? These are my seats. So this is exactly what is called as the allosteric effect. Hemoglobin must have picked up this idea from us, because we used to do that. one oxygen, that is one person, he'll be facing bit of difficulty, पहुंच गया, and then he is occupying all this. So that when rest of the people will come, rest of the friends they come, आराम से बैठ जा. This is what used to happen. Hemoglobin does exactly the same. There are four. If hemoglobin will be picking up 4 oxygen molecules, it is the trouble with the first one. So this first one will be facing trouble. See, that curve is not that steep. And then as soon as it takes the position, immediately rise, right, for rest of them. And then all seats occupied, and this thing continues. So this is what is called as the S-shaped dissociation curve. Dissociation curve for hemoglobin. The question, is this dissociation curve with respect to the tissue level? Well, this is for the muscles. This is for the muscles. And this one is for the typical hemoglobin, which is circulating in the blood. So where is it happening? It is happening at the alveolar level, right? So at alveolar level, you get like this, and here is the capillary, and let's make it big. This is our hemoglobin, right? Oxygen is over here. So many oxygen. So this first oxygen, when it enters, right, and it attaches, there is a problem. There is trouble, right? Because it will take time. But as soon as it is attached, it will open up these spaces for rest of the oxygen. So by the time they reach over here, others will tuck, right? Others will be attached. And thus fully loaded this hemoglobin that will move further. No, this name itself is dissociation, right? Because it is releasing from the alveoli, right? It is from alveoli, it is going, and it is picking up over here. So this is the name which is given. So the point over here is 2 points to remember. The thing what is called as the cooperativity. Cooperativity means first oxygen will promote rest 3 oxygen. So it will pick up much faster. And that is what is called as that. And this is the reason for S shape. This is a very common question for any of the exams. So by the way, from today onwards will be whenever I'll draw like this. So that means just understand that this is the competitive exam question. Competitive exam question. Right? So competitive means it could be USMLE, BLAB, or NEXT, or FMG. But I'll keep on marking like this, right? So that you will understand that this is the point which is to remember. What are the keywords? Reason for S-shaped curve. S-shaped curve. So initial part is smaller, right? Steeper. I'll not say smaller, but it is steeper. Steep because it is the first oxygen molecule which is undergoing the process of, say, association, right? Once it is associated with you, so it will call others, right? So they'll say bye-bye to alveoli and come, and then so this example, this is what we used to discuss even when we used to sit into the compartment. So that S-shaped curve is because of this. I still miss those college days. After dinner, say no one was interested in kya padhai karni. So we used to sit on the stairs of Vishwa Medical College, and then say the person who will be teaching, he'll be sitting here, baki ke sab yahan niche. And then you say, acha chal bol ke kaun si disease, right? And then we'll say, which murmur, which hard sound, right? So we used to mimic, and similarly all these discussions. But that's the way to remember. Okay. I answer all those questions. First, let's finish this. Remember the word allosteric effect. Allosteric. So allosteric effect is, it could be either positive or negative. Right? Yeah, allosteric effect, it could be positive or it could be negative. Positive means, say the things what we just saw, that is, the definition of it is that one molecule, or it is also called as the subunit. One molecule or the one subunit, it changes affinity of binding for other. It's one molecule or the subunit, it changes, this is important, it changes affinity for other molecules or subunits. When we say it changes, so it can either increase the affinity or it can decrease the affinity. So if it is increase the affinity, it is called as the positive allosteric effect or the cooperative. If it is decreasing, then it is called as the negative allosteric effect. Right? So over here, when we talked about hemoglobin, so in hemoglobin, it is increasing the affinity, right? Because it is increasing the path for rest of them. So that's why it is called as the positive allosteric effect. And it is also called as the cooperativity. Cooperative. One and the same thing, just a name. Right? So, but when they use this term, that cooperativity is a positive allosteric effect, true or false? So that's where we understand that yes, it is true. Or hemoglobin and oxygen is having positive allosteric effect. That is true. But let's say if I ask a question, 2,3-BPG and hemoglobin, right, is having positive or negative allosteric effect. Your answer is positive or negative. I'm not speaking that. One answer as a question. 2,3-BPG and hemoglobin. 2,3-BPG and hemoglobin. They are having positive allosteric effect or negative allosteric effect. Meaning is that one molecule of or one subunit of hemoglobin, let's say hemoglobin, it will change affinity for other molecules. If it is increasing the affinity, it is positive. If it is decreasing the affinity, it is negative. So question is, 2,3-BPG and hemoglobin is having positive allosteric effect or negative allosteric effect. What is 2,3-BPG? We discussed it. 2,3-BPG is good for 2,3-BPG. It is good for tissues. It promotes oxygen release from hemoglobin. 2,3-BPG. It promotes oxygen release from hemoglobin. It is good for the tissues. Positive, 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 positive. Which answers are coming? Wait for 30 seconds. Okay. Positive. I'm not telling that positives are wrong or negatives are wrong. See, but make an attempt. So when you attempt, it happens like when you are watching any of the suspense movie, right? We are all born Sherlock Holmes, right? We are all born detectives. So when the movie is going on, we feel kya isine koi kiya. And then when it is released, when the secret is released, if we are right, so we feel so good. So basically, I am a very smart person, right? If it is negative na, we feel कि साला am I such a fool कि इतना भी पता नहीं चला. But in both the cases you will remember the event very much. Remember the event very much. खूब याद रहेगा because your emotions are involved. So this is like those who have answered positive, they'll feel good. But those who have answered negative now, in your life, you will never forget this part. Okay, okay, sure. Let's see. 2,3 BPG and hemoglobin. Hemoglobin over here loaded with oxygen, 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 oxygen. 2,3 BPG comes, right? And he tells, yaar, yahan pe these are the tissues. Right? Oxygen is just a mohmaya, right? So त्याग करो, right? So it means it will say कि जा, right? Oxygen छोड़ो, and oxygen released. So this is what will be utilized by tissue. So this means it is decreasing the affinity for oxygen, right? It is telling hemoglobin, right? This oxygen is all mohmaya, right? Don't love so much. Then they say, "Acha, Swamiji, no problem." So that's why this is a negative allosteric effect. Got it? Negative allosteric. Arey bacha, don't write sorry. There is nothing to sorry about. It happens. But easy. Always remember this part. It changes the affinity. Agar jo affinity is positive, right? If it is positive, then it is called as positive allosteric, right? Something which is happening over here, right? Something the way we were traveling into that train, right? So, यहाँ पे मेरा दोस्त आएगा, झगड़ झगड़ के, right? वो 4 सीट, right? Yeah, I used to be झगड़ झगड़ के. एक बार तो किसी को ऐसा बोल दिया था कि हम जब आगरा जाते हैं तो आई पुट माई रुमाल ऑन ताजमहल. एटलीस्ट तब तक के लिए ताजमहल हमारा होता है. सीट तो कौन सी बड़ी चीज है, तब तक तो फ्रेंड्स की. फिर वो 4 जने आते थे, देन नो वन विल द पंगा. वी यूज्ड टू ट्रीट देम साइकोलॉजिकली. वन ऑफ माय फ्रेंड वुड से कि अरे यार जानी, तूने लास्ट टाइम उसको कितना मारा. ठीक है, वो पंगा कर रहा था, तेरी सीट ले रहा था. देन साइलेंटली पीपल वुड से कहा जाने. We used to give very creative numbers. We used to say, and obviously, when you are in first MBBS or second MBBS, the auscultation कुछ ज़्यादा आता नहीं था. But we used to keep the stethoscope always with us. And वहाँ बैठ के, then we said, देख जब तक stethoscope गले में ना तो डॉक्टर डाल दिया ना तो हमसे बड़ा गुंडा कोई नहीं. कहता ठीक है बैठो. I'll tell you even more about एक रिक्शा वाले को क्या. From railway station to civil hospital, the rickshaw charges at that time it was hardly 15 rupees. Right? The distance is also not. बस सुबह सुबह मतलब 5 बजे ट्रेन रुकी, एंड देन दैट रिक्शा वाला पता नहीं मतलब व्हाट वाज ही. ठीक है, उनका सिविल हॉस्पिटल, ठीक है, पहुंचे, कहते 100 रुपया. कितना? कहते 100 रुपया. ठीक है भाई, काम करो, हॉस्टल ले चलो. हॉस्टल पहुंचे, ऊपर जाके मैंने कहा मैं पैसे लेके आता हूँ. ठीक है. बस फिर सबको जगह, मैंने कहा रिक्शा वाला 100 रुपये मार. अरे वाह वाह. फिर रिक्शा वाले को बोला क्या वो चाय पी के. देन वी टुक हिम टू द कैंटीन, एंड फ्रॉम कैंटीन यू कैन सी द होल ग्राउंड. एंड देन हियर वाज द रिक्शा, राइट? एक रिक्शा के अंदर एवरीवन, वी वर अबाउट 10 जने बैठे. आई वाज ड्राइविंग, राइट? एक यहाँ लटका, एक यहाँ पीछे आगे. एंड देन माय अदर फ्रेंड्स वो खिड़की में से दिखा रहे हैं कि हाँ ये लोग भी क्या रिक्शा चलाना सीख रहे हैं. मतलब पूरे ग्राउंड में उसकी रिक्शा घुमाई. फिर उसको बोला कि 100 रुपया होता है. कहता नहीं साहब. बट देन ही वी गेव हिम 50 रुपीज. कहते यार चलाने का, रिक्शा चलाने का मिला. दैट इज. एक चोर को मारा था, हाथ भी नहीं लगा. हमारे रूम में चोरी कर रहा था. वी फाउंड दैट रात को सब, क्योंकि बिकॉज बीजे मेडिकल के हॉस्टल के दरवाजे सब खुले, so, सब आराम से सो रहे हैं, देन ही वाज डूइंग दैट चोरी फ्रॉम कैंटीन का ही लड़का। गार्ड कौन से गार्ड, हम ही गार्ड थे, कोई गार्ड कुछ नहीं, वेरी बिंदास हॉस्टल। तो पकड़ा उसको, एक जने के पांव पे वो देखा, कह रहे यार सबके पर्स में से, ट्राउजर में सबके पैसे, ही वाज नोइंग दैट अभी फीस भरनी है। देन आगे चलो चलो कोई बात नहीं, पकड़ा, एक हाथ नहीं लगा, एक थप्पड़ नहीं मारा, right? उसको उल्टा लटकाया फर्स्ट फ्लोर से, और नीचे पहुंच गया, मतलब ऐसे इज दैट लटके उल्टा, राइट। एंड देन वो स्काल्पेल लेके आए। मैंने कहा कि यार, एक सीनियर था, मतलब सीनियर इज लाइक 6 महीना साल सीनियर। मैंने कहा कि यार अमित भाई, पता नहीं चलता वो डिसेक्शन में, वो मार्कर से क्या डिसेक्शन सिखाता, कहता लाओ मैं सिखाता हूं। मैंने कहा मैं क्लीन कर दूं, तुम विद द फोर्सेप्स उसको क्लीन किया, मतलब उसकी आईब्रोज निकाली। एंड मैंने कहा कि अभी मुझे ना वो उसका वो नोज का डिसेक्शन आप सिखा, वो स्काल्पेल लेके, अच्छा पहले पेन से ना मार्क करो, और वो जोर जोर से चिल्ला रहा है, जोर जोर से, राइट, मतलब पूरा मार्क किया, राइट। एंड देन कहा कि बस, नहीं आईब्रोज से ओनली जस्ट शेव्ड द आईब्रोज, कट बिल्कुल नहीं, नॉट अ सिंगल ड्रॉप। पुलिस को फोन कर दिया था, और उसको लटकाया था, फिर देखे देखा पुलिस की गाड़ी आ रही है, फिर उसको नीचे उतारा। द मोमेंट उसको नीचे उतारा, वो दौड़ के पुलिस के पास कहता है कि हाँ मैंने चोरी की थी, मुझे ले जाओ। और और कहते ये गुंडे लोग हैं, मुझे मार रहे थे, देखो मेरा पूरा मुंह लाल लाल, देयर वाज नथिंग लाल लाल, इट वाज सॉस। वो उसके ऐसे उसके वजह से टपका रहे थे कि देख जमीन पे गिरा, बिकॉज़ दे बी एबल टू सी दैट, अरे मेरा इतना खून, इतना खून, मतलब एक थप्पड़ भी नहीं मारा था, पर वो, आई ग्रेजुएटेड 1990, it's been 35 years, did my post graduation in my, I mean, ये बात तो यार मुझे मत, आप सब तो बहुत शरीफ, डाकू डाकू, वी वर ऑल डाकू, मतलब हॉस्टल से वापस आके वी यूज्ड टू डू बॉक्सिंग। आज की तारीख, हिज नेम इज डॉक्टर दिलीप, उसके साथ बोला बिंदास, वी यूज्ड टू डू द बॉक्सिंग। पैसे लगाते थे, 5 पैसे 10 पैसे मेरे पे पैसे लगाते थे, कुछ दिलीप पे लगाते थे, वी यूज्ड टू डू बॉक्सिंग, इनफैक्ट इट वाज कुश्ती, गार्डन था वहां पे, संडे को वी यूज्ड टू गो टू स्विमिंग, मतलब सबके पास, मतलब जो पीछे देर वाज अ थिएटर कॉल्ड गोल्डन कटार, सो आर्मी आर्मी थिएटर, ओपन एयर थिएटर, बारिश हो रही है, स्क्रीन धीरे धीरे वो पानी नीचे उतरेगा, देन स्क्रीन विल बिकम इवन, सब बैठ के आराम से मस्त मूवी फुल। एंड द ओनली डिफरेंस बिटवीन द आर्मी प्रोफेशनल, मतलब आर्मी पीपल एंड द सिविलियंस वाज, वी वर नॉट हैविंग छतरी, सो हम आराम से देख रहे हैं, उनके पास छतरी होती है। रैगिंग तो हमारा, आई टेल यू, कभी रैगिंग नहीं किया किसी भी चीज में, नेवर एवर। बस ओनली थिंग उसको कहते थे कि यार गुलाब जामुन खिला दे, बस दैट्स इट। एंड संडे संडे इट वाज लाइक, सभी कैंटीन वाले कहते थे ये राक्षस लोग, वी यूज्ड टू ईट हैवी, द रिकॉर्ड इज 128 गुलाब जामुन। तो इवन टुडे आल्सो माय मॉम वुड से कहीं जाके खाना मत, वो बेचारा हालत खराब। हाँ हाँ बस, 2 कमंडल, कमंडल यू नो, कमंडल, वो मतलब उसमें खाना, उसके 2 कमंडल। Anyway, coming back to this, so this is now you'll at least you'll not forget about the allosteric, positive allosteric. There is one, I tell you, one another very interesting allosteric effect. It is between, we'll study this thing in biochemistry, but this is ATP, and there is one other substance which is an enzyme. Right? This called as the fructokinase. Fructokinase, and it is also called as the PFFK. To be specific, one, but there are two types. Right? So this is ATP and phosphofructokinase. So this is one of the important enzyme which is used in glycolysis, in the process of glycolysis. What it really does is, so when there is enough ATP, right? When there is enough ATP, because this is between ATP and phosphofructokinase. When this phosphofructokinase will be working, so that means it will be generating more energy. So it will generate more energy. So that is part of it. So right now ATP is not there, but when there is enough ATP, right, sufficient energy has been produced. So then this enough energy, now we don't need more energy. So at that point it will come and it will inhibit this enzyme. That means ATP and phosphofructokinase is having negative allosteric effect. More ATP, it will inhibit the enzyme phosphofructokinase so that it will start producing less energy. It will not act on glycolysis. Glycolysis is not there, so less energy is produced. That is how this thing goes. One more example, which is one of the very fine examples, but it will be coming into pathology. In fact, pharmacology. In pharmacology, you say this is not going into much of the detail, but you know penicillin, one of the very powerful antibiotics. This penicillin, what it will do is, now see, this is the bacteria. This is the bacteria. This is antibiotic, it means it will be killing the bacteria. Bacteria has got the cell wall. This is the cell wall of the bacteria. Cell wall. Right. In order for this cell wall to remain healthy, there is one very important enzyme which is needed, and it is called as the DD transpeptidase. Transpeptidase, which will be acting on all those protein molecules which will be passing through and through the cell wall. So that's why they are the peptides. Peptide means these are the proteins. These are the proteins which are passing through and through. So that's why they are the transpeptidase. Right? So this is for the bacteria. About the bacteria, DD transpeptidase is needed for the survival of cell wall. What penicillin does is it has got the negative allosteric effect. So it will act on it and it will inhibit this transpeptidase. When it is inhibited, that means cell wall will become weak and it will break. Bacteria would die. Right? So this is, penicillin has got multiple effects, but one of the effect is this. It is not so that this is the only effect. Penicillin has got multiple effects on bacterial cell wall. Right? That's how it acts as a very powerful antibiotic. But its life is less, so that's why many times it is combined with other substances so to increase the life of the penicillin, so that it can keep on acting. We'll study it in pharma. But this is one of the other examples of negative allosteric effect. Okay. So when we say about this hemoglobin allosteric effect, it is not so that only the this oxygen, pH, temperature, carbon dioxide, right? All these things they will be affecting. They are called as the allosteric effectors. Right? So all these things they can affect, because if the pH is increased or decreased, or temperature is increased or decreased, all these things they affect this allosteric efficiency. Okay. Now we learnt about the curve. So now we'll be talking about only one curve, and that is this normal curve. This is our normal curve. When everything is fine, this is how things are going. So this is the hemoglobin saturation, hemoglobin percentage saturation against the, this is pressure of oxygen. What we are now discussing is this is the right side, this is the left side. The way as if it is in front of us. So now we are talking about the right shift. We're talking about the right shift. This is, let's say, this is 25. This is 50. This is 75. This is 100. What if when we unload the oxygen, when we unload the oxygen, so, or in other words, if we say that there is more, right? Oxygen is now more. Oxygen is more. More oxygen needed. So, or let's forget this. Forget this. I'm just drawing it, and then we decipher what exactly it is. Here is, we draw. This is another curve. This is another curve. We said right-sided shift. Right-sided shift. Right-sided shift. This means this is on the right side. So that's fine. How will it affect? On the same oxygen pressure, if I really draw it like this, if I draw it like this, what can you make out of it? What can we make out of it? Or I'll still be interested. Here it is. Now it will be much easier. Very easy. So if I just, like, this is 25, this is 50, this is 75. This means that when it is right-sided shift, this is the right-sided shift. That means at the same pressure, right? This is the same pressure. This is the same pressure of oxygen. Over here, the oxygen saturation is about 50%, while in case of normal, the oxygen saturation is 75%. Am I clear? At the same, right, same SpO2, same oxygen pressure, the hemoglobin saturation, in case of normal, right, normal it is 75%. But because of this, our new patient whose oxygen curve is shifted onto the right side, that means this is a right side shift, right shift. So the oxygen pressure is now, hemoglobin saturation is just 50%. Hemoglobin saturation. So what type of curve is this? This is the curve which is telling release the oxygen. This is the curve which is telling when it will happen. It means that this particular hemoglobin won't be holding the oxygen for long. See, over here, even at any of the point, draw one at the beginning. This is the pressure. This is the pressure at which almost the 40% of the hemoglobin was saturated. But in our right-sided curve, shifted curve patient, does not even start. That means in this case, these are the interpretations of it. This is the interpretation in which there would be increased CO2, correct? Increased this phosphoglycerate, because it is telling chodo, right? Release the oxygen, right? Don't keep it. No maya. When the temperature increases at higher temperature, right, it will release it. When there is increase in H plus ion, When there is increase in H plus ion, it means environment is acidic. It means the pH is lower. Correct? pH is lower. So in all these cases, the right-sided shift tells that easier to release oxygen. When it is easier to release oxygen, so obviously the hemoglobin is said to release the oxygen. So hemoglobin will be less saturated. Is this concept clear? Because this is, I'll put double star. In Viva, they love this. They'll just draw and then they'll say, they'll ask any of these things to tell me what would happen to this BPG. There would be increased BPG or less BPG? More BPG, because it is releasing the oxygen. It's telling, let the oxygen go. Right? Swamiji has come. More acidic. So hydrogen ions, when they are more, it's more acidic. Let it go. Right? Higher temperature, higher CO2, higher CO2. Right? So it is telling, let it go. Fine. Is this any doubt in this? If there is any doubt, just let me know. All good? I don't mind, but बोलो तो सही आप. This is a normal cow. This is the right shift. So what was this? This is the hemoglobin saturation. It means how much oxygen has been picked up. How much oxygen has been picked up by hemoglobin. And over here, it is the pressure. How much oxygen is present. So over here, when we really draw it like this, so it is at one specific pressure, koi bhi pressure, at any specific pressure. Then normally, this much oxygen would be carried out by that, let's say it is 75%. Normally, this much oxygen is carried out by hemoglobin. But when the curve shifts, this is not good. He is carrying only 50% of the oxygen. Hemoglobin is saturated just 50%. That means there is space of 50%. Out of 4 spaces, only 2 spaces are occupied. Over here, 3 spaces are occupied. So this is more efficient because it will be carrying the oxygen. This is less efficient. This is what really happens in many of the disease. Right? In many of the disease, when it is said that oxygen curve or this curve it is a right-sided shifted. It has shifted to right side. So when you find when there is more carbon dioxide, right side shift, because they are unable to carry the more oxygen, right? The hemoglobin is already releasing the oxygen. When 2-3 BPG is more, so he is constantly telling, right? All more Maya, chulo oxygen, when there is more hydrogen ions, that means it is more acidic, right? When it is more acidic, that means pH less than 7, so that is acidic, so that means there is decreased pH, right? This is and in the higher temperature, all things higher temperature, higher BPG, higher hydrogen ion, higher carbon dioxide, they all are having negative allosteric effect. That means they will be telling the oxygen, jao, right? Hemoglobin साथ त्याग करो. So hemoglobin and oxygen separate. Am I clear? So this thing would be good at tissues. because this oxygen will be released so tissues can use it. But here, the point is that the hemoglobin saturation decreases. This is what is called as the right-sided shift. Right-sided shift. On to the next one. This time, you must have guessed it, left-sided shift. So that is pretty easy, right? Left-sided shift. So when it would be the left-sided shift, this is what would happen. This is the normal curve, normal S shape. But this time, left side. Over here, this is the hemoglobin saturation. We are interested in that. So when I draw a line, and anywhere you draw a line. So here and here. So see this, definitely this top 1% is higher. So let's say if it is 75% and this is the 50%. It means what? It is not letting, the left-sided shift means it is not letting the oxygen go. It is holding the oxygen. Right? It means left-sided shift means it is harder to release oxygen. Harder to release oxygen. So here, that is what is called as the left-sided shift. Efficiency, well, tissues won't like it. Right? Tissues won't like it. You and your friend, they are going for ice cream. वहां जाके जब पैसे भरने हैं तब वो जेब में हाथ ही ना डालें. Very hard to release the money. So you won't like it because then you have to pay. Tissues won't like it. जहाँ पे जरूरत है, right? Where they are really requiring the oxygen, वहीं पे this is the shift has become left, so not releasing it. So whether efficiency increased or decreased, it depends upon where you are. So left-sided. So that's why this is a very typical meaning of it. Harder to release oxygen. So in case of left-sided shift, there would be decreased CO2. There would be decreased BPG, 2,3-bis-phosphoglycerate, decreased BPG, because now no one is telling the oxygen ka tyag kar. No one, right? Decreased temperature. So hemoglobin is not releasing it. Hemoglobin is not releasing it. So that means tissues will not be getting it. So at height or when there is chilled atmosphere, when the temperature is very negative, in spite of breathing, you find that you will feel discomfort because oxygen is not getting released. Due to low temperature, it is holding on. Decreased H plus, that means it will be more alkaline. That means that the pH will increased pH. The pH will rise. So this is one of the very important concepts. The left hand shift can be true. You're right. For hemoglobin F, right, fetal hemoglobin, we can say that it has got a left-sided shift. Absolutely, because it has got tremendous affinity for the oxygen. Right? So perfectly right. So over here, we can, yes, you are right. So I'm writing it here. Say for example, hemoglobin F. This is hemoglobin F. Very nice, right? So this is fetal hemoglobin, and in fetal hemoglobin, left-sided shift. Now we talk about some of the poisons. First poison, which is pretty common, carbon monoxide. In many of the Nazi camps, this gas was used for the mass killing. Carbon monoxide, what it really does is, the first thing about carbon monoxide, it has got 240 times so it will, at every place wherever the oxygen is to be attached, this has got 240 times more affinity, love for those sites. So before oxygen goes, that market, right, you'll say oxygen baaju mein. These are the four, this is the hemoglobin. These are the four seats where the oxygen is to be attached, right? So these carbon monoxide, they will jump, they will say, no, these places are for us. Right? Over here, oxygen. So it has got 240 times more affinity of oxygen. So that's why the places where the oxygen is there, or the oxygen binding sites. Oxygen binding sites. 250 times, 240 times more. So obviously, this carbon monoxide, it binds to it binds to iron. Binds to iron. So in this process, it will block oxygen binding sites. Right? Blocks oxygen binding sites. When the oxygen binding sites are there, so that means less oxygen would be carried out by that hemoglobin. So, and one of the worst thing is, even if this oxygen, right, if it is bound, so here I take you to मुंबई की लोकल ट्रेन में अगर जो आप बैठे लोकल ट्रेन, so here it is, those who are in Mumbai, then for them it is easy to understand, but this is the Dadar station, this is Borivali, and then okay, so which station is over here? इसके बोरीवली के बाद के स्टेशन एक दो का नाम दो. Then निर्माण. Churchgate is on this side. Churchgate. These are all Virar, Bhayandar, exactly. Virar, Bhayandar. So let's take the Virar. What happens is, Dadar se there are trains. There are trains which are till Borivali. There are trains which are till Borivali, and there are trains which are Virar. अब दादर से कोई बैठा, if he tries to get off at Borivali, ना मारते हैं उसको. जब तुम्हारे लिए भाईंदर, चलो ठीक, I don't mind. तो भाईंदर मारते हैं उसको. क्यों? कि तेरे लिए अलग ट्रेन है, तो हमारी ट्रेन में क्यों बैठे? तो हमारी ट्रेन में क्यों बैठा? This is what really happens, and it is true. उसको उतरने नहीं देंगे. चल all the way. They'll यहाँ पर खींच लिया. This is what this carbon monoxide will do. Carbon monoxide, when the tissues will come, already 3 seat पे तो this carbon monoxide they are sitting, right? They are sitting. So they won't offload this oxygen, right? They won't allow it to offload. So this is not offloaded. इसको भी पकड़ के आ गया, and then by the time tissues के पास पहुंचे, इसको मतलब they don't allow this oxygen to get released आगे, right? So tissues won't be getting this. This is the typical thing. So when we studied, जब first time मुंबई गए, तो मैंने बोला कि यार ये सारे सब कार्बन मोनोक्साइड जैसे हैं. So these are the examples that we forget it. This means which side shift? Now tell me. Which allosteric effect, which side shift? Now the question is, the example which I gave, carbon monoxide, it is doing what? This is what is asked in exams. 2 questions. Which allosteric effect and which side shift? Answer. All of you answer. Don't worry about right, wrong. Allosteric, first, let's. All answers are coming. Positive, negative, right-sided shift, left-sided shift. First, पहली चीज. See, those who are telling right-sided shift, is it harder to release the oxygen? Wait. Is it harder to release oxygen or it is easy to release oxygen? In this, is it harder? If it is harder, correct, you're right. But then which side shift? It's 37. So harder to release oxygen? So very easy answer. This is left shift. Allostatic effect. Is it encouraging the oxygen कि आओ attach हो? Yeah, it is telling कि ना, कोई oxygen will not be allowed. Right? आने नहीं दे रहे oxygen. They are not allowing the oxygen. So भगा रहे हैं. That's why it is negative. No, not encouraging. Correct. So it is a negative allostatic. Perfect. It is negative. These 2 questions. The people say that they are so complicated. Jara bhi complicated. It is so crystal clear. But remember these things when after 2 years also you will not. Because abhi to yaad hai. But never get confused in your exam. Why it is harder to release oxygen? Because it is the effect of this carbon monoxide. It is the characteristic of carbon monoxide that it won't allow this oxygen to offload. It will hold it. Right? Now, these 3 places, technically speaking, why it happens like when there are 3 places when the carbon monoxide is attached and it is attached with 240% affinity, right? 240 times love for these sites, kursi ka moh, right? Itna zyada. So it won't allow. So then they are telling him also, tu bhi kyun ja raha hai, bet. So it is not allowing even the release of this. It is because these 3 are making the bond so strong that it is even not letting the oxygen also. Right? So that's why this is train ka example. This is why it is happening like this. Right? So now we are told to draw the curve. So here is the hemoglobin saturation. Right? Hemoglobin saturation. And this is the oxygen pressure. This is our normal curve. So that's our normal curve. What would be the case of carbon monoxide? How will be the curve of carbon monoxide? I'll draw and immediately understand that it has to be the left shift, right? So yes, it will be the left shift. left shift. But will the hemoglobin be saturated with oxygen? No. Because say rest of the for the oxygen, it is the decreased capacity. So oxygen carrying capacity decreased. This is carbon monoxide poisoning. Simply one reason, because carbon monoxide has got 240 times more affinity for the oxygen binding sites. And this would be the left shift. Left shift, whatever the oxygen it is there, it is not even allowing offload. That's why this is the left shift. Harder to release. Right? It will never get saturated with oxygen. No, it will never get saturated with oxygen. And that is the reason for the carbon monoxide poisoning. When you are giving the treatment, you have to give them more and more oxygen. That as the more and more oxygen, hyperbaric oxygen, when it is given with the pressure, so that it can kick off the carbon monoxide. So this is the typical curve of carbon monoxide poisoning. Again, a very, very high yield. These are they are called as high yield questions. How the patient would really present, or the sign symptoms. One, the sign symptoms, they will be non-specific. Right? Just from the sign symptoms, it will be very difficult to figure out that this is a carbon monoxide poisoning. But what are the typical things which will happen? One, the headache. Headache is most common, because our respiratory center is most sensitive to decreased oxygen, because this will lead to hypoxia. There is decreased oxygen, so that the brain would be their brain will start getting the effect first. Right? Next, what would happen? The brain will try, right, but it is getting less oxygen, so that's why dizziness. And when the dizziness occurs, cyanosis will occur. Next stage would be the cyanosis. First, the dizziness, then the nausea, uncomfortable. Will start with during exercise, if you are doing the exercise in which you are not comfortable, or when you are going beyond your level, yes, it starts giving headache. Then, as you very rightly said, cyanosis. So here, this is one very typical thing about the cyanosis. When we say cyanosis means what? Blue. Person becomes blue. Now, but here, this hemoglobin, this is a carbon monoxide. So carbon monoxide hemoglobin. So it is called as the carbon monoxide hemoglobin. That would be found, correct? Because hemoglobin and one with the carbon is. So it is called as the carboxy hemoglobin. Carboxy hemoglobin is much red. So that's why what it really gives is the cherry red lips. This is called as the classical sign. Literally as if someone has eaten the Banarasi pan, right? And then that filmy style. So that's how the lips they would look like. Cherry red lips. So over here, remember in bold and clear, no cyanosis. Pink lips. Are pink nahi, they are literally red lips. They are literally red lips. That is no cyanosis. So no blue lips. Yes, you guys were very shy. तो कैसे कैसे comment, there was, say, in the annual function, and the comments are, it is allowed तो कुछ ना कुछ comments pass करते हैं, teachers, or we use this carbon monoxide poisoning for many of the drugs. मतलब I am not telling आपको you are too very much. So this is like carbon monoxide poisoning. In this, one more thing which you need to understand is, the pulse oximeter, the standard pulse oximeter. जब भी मतलब they just connect and they say that what is the oxygen. Standard pulse oximeter. This is when you will go to clinics. Standard pulse oximeter is useless. This is one of the questions. Standard pulse oximeter is useless. It cannot differentiate. It was famous during COVID. It was very famous. But if it's a carbon monoxide poisoning, that particular thing, see, it is based on the photometer. Right? There is a photosensitive. It is called as the photosensitive diode. The semiconductor which is used is photosensitive diode. So when the light is emitted, it gets reflected, and depending upon the redness, it is getting reflected, and then it is calculating, and then it is the percentage. Over here, our carbon monoxide, right, carboxyhemoglobin is already so red, so it will be giving wrong results. Right? So it will be giving wrong results. So that's why carbon standard pulse oximeter is useless. You require a very special pulse oximeter. So, which diagnosis, right, which detects this carboxyhemoglobin level. So, carboxyhemoglobin level, normally, this is considered as normal when it is less than 3%. Less than 3%, nothing can be happening. किनको होता है ये 3%? It is useless for just few poison. Yeah, it is useless just for carbon monoxide poison. Otherwise, बाकी सबके लिए it is fine. But ये ध्यान से सुनना. Normal. Why it is said that is 3% is normal? Because smokers, they are having 10 to 15% of carboxy. तो ठीक है, कोई check नहीं करता, but and the girlfriend of such smoker will be having this problem. इनको भी होता है. It is because the passive smoking is more dangerous. Poisoning is when it is more than 15%. Think of itna kam gaya. And what is the treatment? Treatment is oxygen. We need to give oxygen so that we can wash off the carbon monoxide. Right? Let's take one more case. Now this is what is called as the methemoglobinemia. This is one of the hemoglobin disorder. But this is one of the disorder. What is happening is the hemoglobin substance itself is changed. And there is only a small change. And that change is usually by drug. Specific drugs. What will they be doing is that it is Fe++. Right? Normally, iron is into this reduced form. This is what is called the reduced iron. Instead of this Fe+2, it becomes Fe++, or the Fe3. So this Fe2 is replaced by Fe3. So when this Fe3 is present, that is called as the methhemoglobin. The trouble is Fe3 has got no affinity for oxygen. Cannot bind so such hemoglobin is useless. Right? And again, Fe3 is a boss. Fe3 is a boss. And so this is the capillary. And here is Fe3. And here is Fe2, the normal hemoglobin. Oxygen, 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 oxygen. This one, right? It has got no affinity for oxygen. As they approach, this is useless, it won't be giving oxygen. But the problem is that remaining this Fe2, it won't allow even this oxygen to be released. It will affect even others. As the concentration increases, it affects even normal hemoglobin. So they can also not unbind their oxygen and then they release it. And the tissues they will be. But this is also a hemoglobin. So it cannot release it. So this is what is called as the acquired hemoglobin because of drugs, because of some of the specific medicines. One of the very common medicine is what is called as the benzocaine. This is a local anesthetic. So how this drug will be going inside? And its very common name is lidocaine. See the patient, right? You want to intubate the patient. So as you want to introduce that tracheal tube, right? So there is a spray available. You spray, spray, and as you are putting that tube, patient is breathless. And you find that patient is becoming blue, right? This is because of methane. Second, there is one component which is called as the nitric oxide. Nitric oxide as such is a versatile, but this is one of the effects. Then there is another drug which is called as the dapsone. Dapsone is antibiotic. This is one of the side effects. So in pharmacology, we'll be talking about in detail about where on which receptors, etc. it occurs. But yes, these are what is called as the acquired methemoglobinemia. And this is because all of them, they are making a change in such a way that Fe++, it is replaced by Fe++. This Fe++ has got no affinity for oxygen. So that's why even in spite of presence of oxygen, but it becomes breathless. Right? In this, the treatment is methylene blue. Very interesting treatment. Pharmacology. There's so much in that. So in this, but you should know the clinical part, right? How the patient will be, because that will create an impression that this is, and in exam, that is USMLE exam. This is one of the questions in USMLE. Straight up, and I'll explain. They give you the clinical scenario. And how it is. The clinical scenario is because of that's right. The Fe3 will be changing the entire, say, polarity in such a way that it will be. So this is the clinical scenario. And in OT, this is a patient which is for endoscopy. Right? And you'll be told that this is a patient which is into his 40s, complaining of, say, gastritis, and then the endoscopy is planned. And in the endoscopy, you take the benzocaine spray, Because after this spray, that area is, it's like it is a throat analgesic. Right? It is throat anesthetic. Throat. So that patient is not feeling discomfort, and it goes. As it goes, patient has become breathless, and patient breathes like gasping. Right? Patient is like gasping. Second, you took some blood. As you inserted, you'll find that suddenly the blood has become brown. It is what is called as the chocolate brown blood. Chocolate brown blood. The chocolate brown blood is because of this method. So immediately you have connected oxygen, right? Pulse oximeter. So that is pulse oximeter. This one, it will give you the variable value. It will give the variable value. Sometimes you find that it is 90s and suddenly it becomes 80. So that value keeps on fluctuating between each time. They can't ban the spray because it is one of the most commonly used. Lidocaine, it is one of the most commonly used spray. And it occurs very rarely, but it do occur. So that's the reason that when you are said that for any of the in pharmacology, they said that it's not a single drug which is not which has got it is impossible. So that is where sometimes you'll find that one drug and second drug. Say in pharmacology, we'll talk about certain drugs that your patient, which is on oral contraceptive pills, OCP, to avoid the pregnancy. This young female, she gets some infection. You give some antibiotics, and you give this antibiotic, and that has been given innocently by you. And after certain days, that patient is telling that she is pregnant, in spite of taking this oral contraceptive pills, because there are some specific drugs which increases the effect of this OCP. When that happens, patient is not knowing. Patient would be under the impression that yes, all the measures are taken, right? So there should not be any problem when it happens. No, who is responsible? Because if the patient is not knowing, and sometimes it happens like they don't even, they feel like that OCP is being taken, so there must be some irregularity of the hormones. And by the time when they really go for the ultrasound or for the check, many times the window of that MTP is medical termination of pregnancy. That is gone. Now, then it becomes a major complication. So this is the reason why it is extremely important for everyone to understand these some sensitive things. Very important. So in pharmacology, we always be learning with respect to the patient, how the patient will be. So over here, what the scenario which I'm giving is, this is how it apply. And why this is variable? Because methemoglobin, right? Methemoglobin, it interferes, right? Or the normal hemoglobin, it keeps on fluctuating. Premature babies. One more scenario. Say premature babies. Now, when the babies are premature, what will happen? The vessels would be constricted, right? So there would be the vasoconstriction. If there is vasoconstriction, like we need to dilate these vessels, right? We require vasodilation. So for pulmonary, pulmonary vasodilation, and you tell sister that okay, start nitric oxide, because everyone knows that nitric oxide is vasodilator. The moment it is done, and you will find that the baby is becoming dull and dull, because this baby won't be able to respond. It's too young. And so that baby, because the shortness of breath, baby will come down and then find that all the findings are going down. So this is where you have to take it like that. Yes, this is because of the nitric oxide. So you need to stop the nitric oxide. As we are discussing, let's talk about cyanide poisoning. Cyanide poisoning. This is also one of the poison which has been used extensively in gas chambers. Very painful death. Very painful. What real cyanide does is this cyanide it binds, and it binds to those iron in cells. Competitive inhibition. Exactly. Right. That you are very right. This is what is called as the competitive inhibition. So when it binds to these cells. This is one, and second, it blocks the electron transport chain in mitochondria. So in cells, in the normal cells, there is mitochondria, so it blocks mitochondria. And in mitochondria, to be very specific, it is what is called as the electron transport chain. Electron transport chain. So it is this chain which is telling how the electrons are getting transported, and that's how the mitochondria function. When this thing stops, what would happen? Because in presence of oxygen, it is the aerobic metabolism. Aerobic metabolism, this thing stops because now no mitochondria. No functioning mitochondria, or the no functional mitochondria. Now, here, though there is air, but it is not getting utilized. Mitochondria, they are not. So no energy will be. So that's why this is what is called as the functional hypoxia. Functional hypoxia. And this thing is bad for brain and heart. Most affected. What would really happen? In absence of aerobic, anaerobic circulation will start. Anaerobic metabolism will start. Anaerobic metabolism. And that anaerobic metabolism will stimulate the formation of lactate or the lactic acid. And that thing is being. So over here, in case of say cyanides, you need to treat it in a very different way. For the treatment part, one important thing you need to do, there is a specific thing what is called as the amyl nitrate or sodium. So what they will do is, see, amyl sodium nitrate. Now, this is, they generate methemoglobin. They generate methemoglobin. So over here, Now, and this is happening in cells. This is happening in cells. So in cells, so there is Fe plus 3 sites. And the cyanide has gone over there. What you do is, you give this amyl or the sodium nitrate. When you are giving this, it will generate methemoglobin. Methemoglobin, so it loves, right? And this Fe3, it will go and it will start competing with cyanide bonds. So this, it generates methemoglobin, and this methemoglobin will fight with cyanide and will displace cyanide. So this displaces cyanide from mitochondria, so that mitochondria start functioning. So here the entire game is from the mitochondrial perspective. Second very interesting is that you give them hydroxycobalamine. It's called as the hydroxycobalamine. Now this hydroxycobalamine, this is like precursor of vitamin B. Precursor means from this vitamin B, it is one generation back of this vitamin B. Now this hydroxycobalamine, it binds to that cyanide. So cyanide which is present in the body, right, it binds this hydroxycobalamine. It binds to that, and it leads to formation of what called as the cyanocobalamin. It's called as the cyanocobalamin. And this cyanocobalamin is very easily excreted. Very easy. Most effective, most powerful. Then there are other things like sodium thiosulfide, because they also get connected to cyanide, and then that is also excreted. But this much is sufficient for this particular topic. So this is like a game of hemoglobin. You must have noticed that so many things can really occur along the way. So we have saved this file, and I'll upload this file so that in one reference everything is. Thank you so much. But next time we'll take one full session on radiology. This Saturday, one full session. Everything. We take the CT scan, we have a look at some MRI, right? But the basic principles of the entire radiology. So enjoy it, right? From the technical aspect all the way how to diagnose. In fact, various angles, how it is taken. You have seen PA view. I'll show you in detail about the AP view. We'll see the lateral view, how to detect whether it is the proper X-ray or not, right? All these things. I'll let you know about the USC. All right. So, thank you so much. And I'll take history. That is when we'll start. We'll be going a bit further now, and we'll be learning, say, the respiratory we are doing, when we'll take the cardiology also. Then we'll combine all those things and we'll do one session on the history taking, how to take the history of the patient, so that it comprises of all the patients. Yeah. Okay. Thank you, and wish you a very